listeners would agree, there is really no credible road to health improvement for people living in poverty that does not go through equity.
Mhm.
And so if we're simply about being efficient and trying to meet our mission, then we have to recognize the role that equity plays in doing that. So we didn't get to equity because, Laura from Lumberton thought that that was something we needed to do or some sort of pet peeve or project of mine. We got there because of what we were asked to do by our founder. And so we have to recognize that, again, opportunity is not equally distributed, resources are not equally distributed, freedom and justice have not been equally distributed in this country. And so we have to actively work to change these problems that we created. We have to actively work to solve them. And so that's what we're about.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 25. Hi everyone, Omari Richards here. Thank you so much for joining me today. It is an interview with someone at my organization who has had a very extraordinary public health career. I get to interview my first medical doctor turned public health professional. And I think it's just a very insightful story. And there are lots of takeaways that I think you are going to find useful for your career, your journey, or just your mindset. So without further ado, here's today's episode. Today, I'm truly excited to have this guest. She has completed her bachelor's in biology at the Harvard and Radcliffe College before attending Johns Hopkins University School of Medicine and continuing on to do a pediatrics internship and residency at Johns Hopkins Hospital. She's practiced pediatrics for a few years before getting her Master of Public Health from Harvard University School of Public Health, where she was a fellow for the Commonwealth Fund Harvard University Fellowship in Minority Health Policy. She has had many roles, including senior medical consultant for the North Carolina Foundation for Advanced Health Programs, executive director for the North Carolina Health and Wellness Trust Fund Commission. She was the state health director for the North Carolina Department of Health and Human Services Division of Public Health, as well as managing director of clinical transformation and then market medical director for Evolent Health. Her current role, and where I'm enthusiastic to work alongside her, is as president of the Kate B. Reynolds Charitable Trust, a statewide foundation that focuses on improving the health and quality of life of people with low incomes across North Carolina. We welcome Trust President Dr. Laura Gerald.
Yay. Thank you, Amari. Thank you for that wonderful introduction.
Yeah, my pleasure. And I'm just really glad to have you on. And I'd like to say publicly, thank you for giving me the opportunity to work with this amazing organization and do the work that you all have been doing. And I'm really excited to just continue to learn and develop as a program officer and make the changes that need to be made to improve health and well-being for North Carolinian residents.
Well, we're excited to have you join the team.
I'm glad to hear that. So, how are you doing and coping during these times?
Doing well. Thanks for asking. These are challenging times, but I am both adaptive and resilient, thankfully.
That is good to hear, and that is a good trait to have, especially right now. So, how do you identify, and you can give us a little bit about your personal background?
Um, she, her, hers are my pronouns. And do you mean in addition to what you've already shared? You've shared a bit about my background there.
Yeah, just a little bit more, if you don't mind sharing.
Oh, no worries. Well, I think you have heard a lot about how I spend most of my time. I'm also a mother of two boys. And so if this interview is interrupted for any reason, it's probably because they are practicing music or wandering around otherwise dealing with virtual school. That is real, but doing well. Thank you.
Okay, great. So, what does public health mean to you?
Well, again, especially given the role that I had as the state health director, for me, it has been a responsibility really for the health of the entire population, and that has been its manifestation in my professional career.
Okay, and I hope we can talk a little bit about that role and how you got into it a little later on. So you got your bachelor's in biology at Harvard and Radcliffe College. So what was the thought process for you entering into undergrad?
Well, I guess a little bit about my background that may not have been shared. I am Laura from Lumberton, actually hail from a part of North Carolina that is, uh, at least by paper statistics, both rural and underserved. But my own lived experience in Lumberton, my hometown, Robeson County, my home county, was one of support and nurturing, where throughout my young and formative life, my education was centered and a priority. And I was in Lumberton through the 10th grade. I ended up leaving Lumberton in the 11th grade and matriculating and graduating from the North Carolina School of Science and Mathematics. And so I actually went to Harvard from a pretty good school in terms of academic preparation. But my thought process entering Harvard from Lumberton still essentially was simply that I was following in the footsteps of my older brothers. I had two brothers attend Harvard, and my oldest, my oldest brother actually went from Olney High School in Philadelphia. We lived very briefly in Philadelphia for a couple of years after I was born, just before my father passed away, actually. So my mother ended up raising four children, single mother, teacher's salary, and my brother in part went to Harvard on a scholarship for the Sons of Widows. And so that decision that he made to pursue his undergrad there, as as you have heard, really influenced the rest of us. Lest anyone think I am academic snob, my sister went to University of North Carolina at Greensboro. So she was the only one of the four of us that didn't go to Harvard, but she is by far the most successful of the and well-adjusted of the four of us.
Okay, great. Well, thank you for sharing that. And then I guess throughout your bachelor's degree, you then decided to go on and get your MD at Johns Hopkins School of Medicine. So did you enter your bachelor's wanting to become a doctor, or how did this formulate in your mind?
I did not. I was a young African American person who was a good student. And as some people might be able to attest, when you're a young minority from an underserved background, you're told to be a doctor or a lawyer. So I had certainly heard um, a time or two that I should be a doctor, but I cannot say that I went into school, into college, pursuing that. By virtue of my background, I had a love of science. My high school biology teacher introduced me to a leaf collection, and that solidified my interest in biology. I was able to pursue that at the School of Science and Math with some advanced courses in genetics and other biology courses. And so when I got to college, and in freshman or sophomore year, I think it was actually freshman year, we were asked to declare a major. I went for what I was interested in and what I enjoyed. And as it turned out, biology was also pre-med in terms of the coursework that you ended up taking. And so I had the coursework to go to medical school, but actually after college did a year in healthcare consulting at a company in New York City in Manhattan. So actually took a year off before going into medical school, but did decide, particularly during that year when I was working in consulting, to go ahead and pursue a degree in medicine, and ended up going to choosing Hopkins and have not looked back ever since.
Okay. And did you apply to get into medical school before you did that consulting, or did you do the consulting and then throughout that you're like, okay, I'm going to apply to medical school?
I actually did apply during that year that I was in consulting, but as is the case for at least at that time when I was going through, it was still a pretty long preparatory process. So I had done the MCATs. I already had the, like I said, the coursework. So I had done the MCATs in college, and we had at Harvard a pretty extensive system of pre-med advising, and so I had also alerted my pre-med advisor to the likelihood that I would apply for medical school during my year off. And so he was particularly helpful in directing me to different schools to apply to. And he was actually the one who suggested that I apply for Harvard and Hopkins and some places that would have seemed like a stretch to me, but he was right and gave me good advice, and I ended up getting into all of those and choosing Hopkins from among them.
Okay, thank you for sharing that. So you did you went through med school and then you ended up doing pediatrics internship and residency at Johns Hopkins University School of Medicine. So did you always wanted to get into pediatrics when you had this thought of becoming a doctor, or how did that come about?
That's another one where I decided as I went through. That has been a theme of my life. I have a general tendency to pursue opportunities as they arise. And so as I was going through medical school and trying to figure out which of the clerkships was best suited to me, I found that I gravitated toward med peds, and those who know medicine can relate perhaps to the differences between sort of a med peds approach to medicine and a surgery OB/GYN kind of approach. And so really that's often the fork that people choose between. And so I was much more along the lines of the history and physical, and using that as a means to pursue diagnoses and treatment. And so I was kind of debating among med peds, and I excelled in both of those clerkships. I really liked interactions with patients. And it's funny when you're going through, it's like, oh gosh, why would you consider peds? You have to deal with the patient's parents. And I always found that part to be, a good aspect of pediatrics. And then when I did my medicine clerkship, as much as I like sort of the science and the way that you think about it, I had like a 3-hour conversation with one patient of mine about her bowel movements one day, and that was it for me. I said, okay, I think I'll do pediatrics. And then I was drawn to the preventive aspects. I think there was always sort of a closet public health person in me. And so the opportunity to really work with the whole patient and to get in on the preventive side of health and healthcare is what essentially sealed the deal for me in choosing pediatrics to ultimately pursue.
Okay, thank you. And then you worked as a pediatrician for 3 years in your hometown of Lumberton. So what was that experience like?
Yeah, it was about that period in my life, the end of residency, that I really realized I was poor. Like I said, I was a fully grown adult before I realized how underserved and much in need my hometown was. A friend of mine in residency jokingly said to me as we were in our third year and just starting to think about the next step, well, if all else fails, we can go back to Lumberton because they're on the National Medical Corps underserved list. There's a National Healthcare Service that will pay back your loans if you go to places that are underserved. And I was surprised to learn that not only was Lumberton on the list, but my pediatrician from growing up was listed as the contact. And so I called them almost just to say hi and see what in the world was going on. I really didn't intend to go back and work there. But after about a 3-hour conversation, I was agreeing to go stop by and see him the next time I was home, for my break. And I ended up signing on the dotted line to return, not just to Lumberton, but to work with my pediatrician from when I grew up. Once I really learned how they were really trying to meet the need in the county and several surrounding counties in a really underserved area. And so I ended up, even though I don't know that I really intended to do extended patient care, I did end up going into direct patient care from residency at Hopkins. And it was then that I realized, gee, I probably should have paid attention a little bit more in the NICU because Lumberton was real medicine. I mean, it was not, tertiary care centers. We were the delivery room, we were the emergency room, we were the health department, we were the clinic for not only our county, but about 5 surrounding counties. And we did real call. And so that was a real experience in clinic. And even though I, as you'll hear, went on to ultimately leave clinical medicine full time and go into public health, I still continue to see patients at that same clinic in Robeson County up until about 5 years ago when I started working at the trust.
Okay, thank you for sharing that. And so you said that you liked like the preventative side of medicine and everything like that. So what was the driving force for you choosing or wanting to go and get your master's of public health? Like what made you want to do that?
Mhm. And so I came to equate clinical medicine with kind of fighting on the front lines for health improvement. And it became clear as I started to do clinical medicine in my hometown that although in Lumberton, as the only pediatricians in the area, we saw all comers. The mayor's daughter, would have been my patient, and so would people that I grew up with or lived down the street from, or who were on farms or living in very distressed economic conditions. So I saw the whole spectrum of patient, but it became clear that my real passion and interest was in meeting the needs of underserved and vulnerable populations, the financially distressed. The majority of our patients in the clinic were, say, on Medicaid. They were categorized as poor. And it became clear in practicing medicine that I could continue to try to stamp out colds and sore throats one at a time and prescribe medications and treatments one at a time, or I could start to have a bigger perspective of what context patients were making medical decisions in. And I credit my mentor, my pediatrician, with, even though we were clinicians, we always had sort of an eye toward the bigger community. What is it that the community needs to meet its healthcare needs? We were open 7 days a week. We were taking call at night, and again doing a lot of even initiatives from within the clinic, not because it was convenient for us or that it made our lives easier, but that we knew it was meeting a need for patients. And so that kind of thinking really helped me to broaden my perspective. And ultimately, it was a desire to have an impact on a different level that took me into public health. I started wondering, okay, I'm here on the front lines writing prescriptions, stamping out colds. What's going on back there with the generals who are discussing how do we deploy troops? How do we distribute resources within a broader community, within a state? And I had done some things. I had started to work on the administrative side of the clinic. I had started to get involved in organized medicine, and had done a few things that sort of also gave me an entree into that bigger perspective. And ultimately, again, I decided I did need another degree because, hey, I like education. So I decided to go into public health to pursue a more population level perspective.
Yeah, and that makes a lot of sense. So when did you know about public health? Like, did you know about public health during your medical school training, or did that come up about afterwards?
I considered getting a master's in public health while in school, but again, a thing that you hear from me, I kind of go through things through lived experience. And one of the things that I determined was that I hadn't yet done enough medicine to know what I would pursue in public health. If I had gone straight through in medical school, I may have pursued, maternal and child health or, health behavior, something of that nature, just from kind of a lack of exposure. But by going out and practicing first and sort of seeing where my real opportunities were in public health, that really steered me more toward the administrative policy side, which is where I had been working while in clinic. I did know about the Commonwealth Fund Harvard University Fellowship in Minority Health Policy. That came to my attention while I was a resident. And what I knew about that was, whew, thank goodness I don't have to pay for another degree.
Mhm.
And so that became very important for me to pursue that because, like I said, I just worked for that period of time to get my loans paid off, and so I didn't want to then accrue new ones. And I also felt like for me, I had colleagues who were pursuing a master's in public health while working full time. It took about 3 years to do that. And I also felt it would be better for me to really focus and concentrate on the public health experience. And so when I was fortunate enough to be chosen for that fellowship, I decided to pursue that and go back to Harvard.
Okay. Okay. And can you talk a little bit more about that fellowship? So just so anyone wants to know, it's the Commonwealth Fund Harvard University Fellowship in Minority Health Policy.
I think they may have changed their name
Okay.
now, the Moingen, so Moingen or something fellowship. Look up Harvard University Fellowship or something in public
Will,
health.
will do.
I do think they changed their name though, but that was also an exposure to me for philanthropy because it was sponsored at that time by the Commonwealth Fund, which is a foundation out of New York. And again, they were trying to affect change in underserved populations by preparing minority or leaders who would be interested in pursuing minority health. And so it helped me to sort of, again, see how philanthropy could be used um, to have this greater impact that I had talked about. And then the other thing that was so, I think, helpful about the fellowship, in addition to the coursework in public health that you were able to take, there was a whole curriculum and mentorship and process of exposing us to minority health policy that proved to be just as beneficial as the degree and the coursework to me.
Okay. And that sounds like a very valuable experience.
Yeah.
So, considering that you were a pediatrician and then you did your Masters of Public Health, what were some big takeaways for you during your MPH?
Um, Well, so having an MD, I was able to get a master's in public health in just a year.
Mhm.
And I was a administration policy concentrator. And so I will say in full disclosure, in just that year's time, and having to take epi and statistics and I took a number of courses at the Kennedy School of Government. What it was able to give me, the MPH was able to give me was a little bit of a broad view of public health across a variety of disciplines, but it did not go too deeply into any of those. So I think that for me, the takeaway was that, having that MPH was a door opener for me more so than anything, to kind of help bridge from clinical medicine into something else. And the other thing that I was able to get from my time there, which was really a time to reflect about where I wanted my career to go. Again, I had a good advice, a great mentor there in the fellowship director who was able to help me see, look, this is not so much about figuring out exactly what you'll do, which is what you do in medicine. You do all the steps as prescribed. But in this case, our time there was really to figure out what we are about, to really focus on honing in on our passion and what it is that we feel our career should help accomplish. And so that's when I really solidified that I particularly am about improving health for underserved and vulnerable populations. And then it's against that backdrop that I could then gauge opportunities as they come. And one thing about going to do a fellowship at Harvard is that everyone who is anyone in public health, all kinds of leaders in minority health policy and in public health in general, came and spoke to us, oftentimes in small group settings with the fellows, and each of them did like what I'm doing today, talked about their career trajectory, and it was uncanny how consistent the stories were. Everyone told stories of chance and how just pursuing opportunities or networking or things of that nature led them to careers that they never could have sat down and imagined or written. And so I calmed down and became less, sort of goal oriented, 5-year plan oriented, and really just allowed myself to focus on what it is that I'm trying to accomplish and see what happened from there.
Okay, no, that makes a lot of sense. Um, so then after this, you became the executive director for the North Carolina Health and Wellness Trust Fund Commission for a year. So how did you get this job, and then what did you do in it?
Yeah, so again, I'm one to pursue opportunities. I had been working for 8 years in improving health for the Medicaid population. Again, very consistent with my newfound mission statement out of NPH, and I connected with people back in North Carolina who were able to expose me to that opportunity to work on a pilot program with the North Carolina Medicaid um, uh, population that was concerned with improving health and controlling costs. It was a primary care case management kind of program that was the state's answer to managed care. And I was, again, serving as a medical consultant there, working largely in disease management and quality improvement. But from that vantage point and working with the states, with a large funder like that, large insurer, I was able to be exposed to any number of other state initiatives. And I was chosen, for example, to be on the governor appointed Health Information Technology Task Force, HIE Task Force. And it was in doing that that I learned about the vacancy at the Health and Wellness Trust Fund Commission. I was, by that point, after about 8 years or so, ready to move on to a new opportunity. And so I applied for the position because it was actually the Health and Wellness Trust Fund Commission is a state government foundation, for lack of a better description. It was using a portion of the state's master tobacco settlement money to do grant making to improve health, largely to curb teen tobacco use or youth tobacco use. And so it was an opportunity to sort of get into foundation work or philanthropy, which is something from my fellowship I knew from listening to different career trajectories that was something that really resonated with me as a real opportunity to have an impact in vulnerable populations. So I applied for that job, and as it turned out, in order to get hired, I had to be interviewed by the governor at the time, Governor Beth Perdue. And so I did, I was one of a few people who were able to interview with her. And from that interview, I was chosen to be their executive director.
Okay, awesome. So you said something about you found your mission in during your MPH. So how important was that for you to find your mission, and has that changed throughout your career?
No, I mean, it was super important, and I've held to that, and I will contend that I've had a variety of positions within medicine and public health, and really across various disciplines that have all been around the same thing, which is improving health for the underserved. I've done it from every aspect possible. I think culminating in the role that I'm doing now, but my entire career has been around that same mission. I've just done it from different perspectives.
Okay, thank you. And after your executive director role, you became the state health director for the Division of Public Health for North Carolina Department of Health and Human Services. So this is a huge role, in my opinion. So how did you come across this role?
Well, again, I tell the same story that a number of folks tell, and that's kind of chance and happenstance. I mentioned that to be the executive director of the Health and Wellness Trust Fund Commission, I had to come to, I came to the attention of the governor at the time. And even though I thought I was doing my dream job to do philanthropy, teen tobacco use prevention, obesity prevention, grant making help the underserved. What I ended up doing at the Health and Wellness Trust Fund Commission was a straight year of lobbying. It was an unusual political season for North Carolina. We had a switch over in the legislature from one party to another, and that party then went to war with the governor at the time. And in part because of that affiliation between the commission and the governor, the trust fund came under political attack, or attack from the legislature. And so I spent that year really lobbying the legislature and working with the governor's office to try to save the Health and Wellness Trust Fund Commission, and was ultimately not successful. It was abolished in the state budget a year to the day after I joined. And so I suddenly found myself um, rebel with no cause. I mean, I was now not working in philanthropy. I was wondering about the next step, and so the by that point though, I had definitely come to the attention of the governor, and so it was that recognition, that relationship, that ultimately had her put me in the office of the Secretary for Health and Human Services. And so I worked with him for about 6 months in his office. And after that period of time, he, with the support of the governor, appointed me to be the state health director. But for sure, none of that would have happened, I'm sure, if not for the experience that I had with the Health and Wellness Trust Fund Commission.
Okay, awesome. And what were your biggest takeaways as the state health director during your time there?
Well, as you said, that's a big job. That is the highest state health official, the highest state public health official, as you well know. Many authorities and responsibilities are granted to the state health director in statute to protect and preserve the health of North Carolinians, which is how, again, I internalize and interpret public health, because I was given that awesome job and responsibility, and did so happily and quite thankfully for 18-month period of time. As you can imagine, there are a lot of different facets to that job. I have found what takes a lot of your attention is water and outbreaks. You need to make sure you are protecting the water supply, and you need to protect the public from outbreaks. And of course, there's also the added responsibility of messaging and helping to set the strategic direction for what we as a state would do to address public health concerns. And so I started to prioritize social drivers of health and things of that nature. But again, a lot of my time was put into managing the duties and responsibilities of the state health director. Thankfully, there was nothing like COVID during my time, but there were outbreaks. We had a fungal meningitis outbreak. We had a number of things that really required, a lot of attention. But I was very thankful to do that work. It helped me to really be exposed to the role of government in health improvement. And so I got to see up close and personal how important that role is, and again, served under two administrations. I think one of the things that you learn in those kinds of roles is that you are affected by political and by changes on the partisan landscape. And so I served 9 months under the next governor, who was of a different party, but ultimately did decide that the direction that that party was taking toward health improvement for me was not consistent with my values and goals. So I did actually resign after 9 months there, because I did not agree with the direction that we were going in as a state.
Okay, and that's definitely probably a very tough decision to make. But
It-
I definitely understand, like, if you had a vision for what the health and wellness needs to be and the role of the government in doing that, and if they just shifted and changed that completely from all the work that you have been doing, it could be very disheartening or discouraging. So
Mhm.
I completely understand that.
A lot about priorities from the budget. That's one thing I learned from working as a state health director and director of the Division of Public Health. And once the budget was passed for the state in that year, just like the Health and Wellness Trust Fund was abolished in a previous budget, I learned in that budget where the priorities were, and I didn't see them in health. And so I didn't see a role for me there. Learned some good lessons, though, excellent lessons.
Yeah, I could imagine. And then we can talk like just briefly on you got a role after this as managing director and then clinical transformation director for Evolent Health. So what did you do in this role?
Well, and so it's interesting. My career was taking off again beyond my wildest dreams. And so, where do you go from practicing in my local hometown to working with state Medicaid to being over the public health system for the state? Well, you go to the national level. And so that's kind of what I got to do with Evolent Health. I essentially served as a consultant to health systems around the country. Again, we're going through some real magnanimous shifts in healthcare delivery and healthcare reimbursement and payment reform. And so I was able to, with Evolent, really help health systems who are on this trajectory toward value-based care, away from volume-based care, fee-for-service care, and was able to really see and help lead efforts with health systems to really think about what that transition means for healthcare delivery. And so I was able to get another experience in healthcare that proved to be, again, very valuable, something that I draw upon very frequently in my current work.
Yeah. Awesome. So you also have sat or you sit on many boards, councils, commissions, task force, to name a few of them: Grant Makers in Health, Southeastern Council of Foundations, North Carolina Network of Grant Makers, North Carolina Emergency Response Commission, North Carolina Sustainable Local Food Advisory Council, North Carolina Early Childhood Advisory Council. So what have you learned from being a part of all these councils, boards, commissions, task forces?
Well, you've seen my whole CV. So a number of those that you called out, I served on those by virtue of the role that I played as the state health director.
Okay.
So most of those last ones, there are seats for that position, and so I'm not serving on those at this time because I'm no longer in that position. But what I learned and what I knew before then and what I know now is that systems change is a team sport. So again, one of the reasons that I left clinical medicine was that I wanted to affect the structural issues that we're dealing with in community and in the state and in the nation that have been set up through communal decisions, whether those are policy decisions or budgetary decisions or organizational decisions. I've long since determined that that's where my career is best served in working on that long-term, broad-based systems level change. And so what that means for me is that I have to be involved in organizational, whatever, medicine, public health, philanthropy, you name it. And so Grant Makers in Health, Southeastern Council of Foundations, North Carolina Network of Grant Makers, those are organizations that pull together groups of philanthropists or groups of foundations to help us try to figure out how to solve problems collectively. And so that's right down my alley. We won't get to systems change from just the work of the trust. And so I do put time and effort and energy into working on boards and in organizations that pull us all together within the discipline and across sectors, because that's how we get to actual organizational long-term change.
Yeah, and I couldn't agree with that more. Definitely, you speak on like building relationships as well as having that interdisciplinary team or like just voices at the table so we can actually have everyone that needs to be there to say what they have to say to try to push this work forward.
Mhm.
So, with all that being said, this brings us to today. You have been the president of the Kate B. Reynolds Charitable Trust for more than 4 years. So, how did you get into this role?
Well, this is my dream job. I'm done from here. I've had a number of different roles. I've had a career that has exceeded my expectations, and this time the opportunity really found me as our destiny has a way of doing. You can't really run from it. And so I'm sure by virtue of the work that I had been doing, not only public health and things like, but I'd also worked with the trust. I think either during or not long after I was the state health director, I was one of the on one of the trustee advisory councils for the trust, and so was familiar with their work in philanthropy. I had worked at the Health and Wellness Trust Fund Commission, which was another, sister health foundation in the state, one of the other large health foundations in the state at the time. And so I was contacted by the executive recruiter for the trust, and again, because I had been involved with the trust, I did know that Karen, my predecessor there, the previous president, had left, and so when the trust called about pursuing this opportunity, I was more than thrilled to do so. I wanted to get back to that love of philanthropy and interest in philanthropy that I'd had really since my days in the fellowship and getting a master's in public health.
Okay, that's great. So, how did your other jobs and roles prepare you for this role that you're in right now?
Well, again, you almost can't make it up. Like I said, I didn't, have some 5-year plan where I was, methodically working through my trajectory to president of the trust. But as it turned out, every experience that I had in medicine and in public health has helped prepare me for this point. The trust has a mission to improve the health and quality of life of financially disadvantaged residents of Forsyth County and of North Carolina. And Omari, I'll be testing you on that mission. We mumble that mission in our sleep around the trust. Um, but what it meant in actual sort of bodies of work, the trust was known for its work in rural health. It was known for its work in early childhood issues in Forsyth County. And so you almost can't make it up. I'm a pediatrician who was working in rural health, who's from a rural area, who had been responsible for health improvement for the state of North Carolina, you know. So really each of the roles that I've served helped to, I think, uniquely prepare me to lead the trust, given its mission and given its bodies of work and what it's taken on as its strategic goals. And so it wasn't a hard sell to me, and I'd like to think not a huge hard sell to Wells Fargo, the trustee. And so really after a short series of interviews, I think it was um, again, I was thrilled to be chosen as the next president.
Yeah, that's amazing. And it definitely seems like a perfect fit for all the roles and the things that you have done. And really wanting to have that systems change and that population level approach to things. So the trust works for thriving communities and residents, equitable access to care, and equitable health outcomes. What does this look like in practice?
Great. So you've already got the vision down pat. So that's strong work. So 5 weeks into it, I'm glad you've internalized that. That's the trust has been around for over 70 years and doing great work throughout that period of time. We were established in the will of Catherine Bidding Reynolds. And so our mission, our goals were given to us 70 years ago. So as you can imagine, we have to constantly kind of reinterpret and refresh that mission in today's context. And so what you just called out is kind of today's context for what we think that mission means and will entail. And so when we look at the charge to improve the quality of life of residents in Forsyth County, we're forced to look at who is not thriving. Who is it that we have to help specifically in order to see that all residents are able to enjoy in the prosperity of Forsyth County. And so what that means specifically locally is that there is a particular attention that we pay to our youngest residents, to children. We have a special initiative, Great Expectations, that tries to see that all children are prepared for kindergarten and life, regardless of income or race or where they, the family in which they're born in Forsyth County. And then we also recognize in Forsyth County that it can be quite predictable who's not sharing in prosperity and in the economy. And so we have an inclusive economy initiative in Forsyth County. And then on the health side, what it looks like is, again, when we think about improving the health for people who are living with poverty, we have to think about, okay, what are the barriers to that? What does that mean? And so essentially today, if you're going to have access to health care, then you need access to health insurance. And so we work very deeply to see that all people are able to access health insurance. We work on ACA enrollment. We encourage and advocate for Medicaid expansion and other forms of insurance that are particularly targeted to people with low incomes. And then on the health improvement side, of course, what I know from practicing medicine and working in public health is that outcomes are not distributed equally. We have health disparities that are intractable and predictable. And so if we're going to improve health outcomes for all, we need to focus on disparities. And again, it doesn't take much scratching on that surface to find that disparities are predictable because of inequities, often longstanding, intentional inequities in many cases that have held certain populations back from things that they need in their communities and in their lives to live healthy lives with good health outcomes. And so we focus in on those, and we also recognize that again, resources and opportunities are not distributed equally around the state. So when we follow the worst health outcomes, that often leads us to rural communities, under-resourced communities, tier 1 counties. So we are specifically working on a special initiative in rural North Carolina that's called Healthy Places. And you're getting to know that and love that initiative. And that's where we work really deeply in community. We've chosen 10 rural counties to work for at least 10 years at about $100 million of investment. And so one of the things it means at the trust is that we get very deep into place. You know, we know Forsyth County very well. We know these 10 communities very well. And we start by listening to them and really working at the local, hyperlocal level on issues that are of concern in particular neighborhoods and cities and counties. And we'll often work to help build capacity within those areas, and then kind of marry it and partner it with some of the statewide work that we've been doing in access to care and in, you know, equitable health outcomes. And so that's what our day looks like. It's a very eclectic day, as you know. It can go anywhere from, you know, talking to somebody who's on a farm out in, you know, eastern North Carolina, to talking with the secretary, you know, for Health and Human Services on her thoughts about Medicaid and equity within Medicaid. And so it's a very uh, rewarding field, and one that we feel is a critical piece of the pie in terms of health improvement and social change and equity. The role that we play in philanthropy and investing in communities and helping to build capacity and helping to raise voice for unheard people is, in my opinion, a pretty good way to make a living.
And I would agree with that. And I look forward to working more deeply in these communities and getting to build those relationships and really strengthening these communities in ways that are equitable. And I'm just really excited for this work. So diversity, equity, and inclusion is such an important aspect of this work, and it's one of the Trust's stated values. How is the Trust bringing an equity lens to its grant making?
Well, again, I think I've talked a lot about our goals, and what I would say, and I imagine many of your listeners would agree, there is really no credible road to health improvement for people living in poverty that does not go through equity.
Mhm.
And so if we're simply about being efficient and trying to meet our mission, then we have to recognize the role that equity plays in doing that. So we didn't get to equity because, you know, Laura from Lumberton thought that that was something we needed to do, or some sort of pet peeve or project of mine. We got there because of what we were asked to do by our founder. And so we have to recognize that, again, opportunity is not equally distributed, resources are not equally distributed, freedom and justice have not been equally distributed in this country. And so we have to actively work to change these problems that we created. We have to actively work to solve them. And so that's what we're about with our grant making. And so every time, you know this already from the time you've been at the trust, regardless of what we're talking about, if it's specific grants or other philanthropic work that we're doing, we're bringing up the impact and role of equity because that's what it takes to be effective.
Yeah, absolutely. So what do you do in your role as president and CEO?
Well, I get to do great things like these things and hire people like Amari. I mean, you know, the word here is responsible and accountable. I am responsible for the overall work of the trust. And so I consider all of the programmatic work and operations work, fiduciary responsibilities, the strategic direction of the trust to be issues that are within my position, responsibility, and purview. And so I get to help strategic direction. I get to help set strategic direction, and I get to assure an organization that can meet that. I assure that for the trustee, again, sole trustee Wells Fargo. And so they hire me to then assemble and hire people like you and see that all of this gets magically done. And so I get to work not only with the staff, but also with the trustee, with the advisory council members to see that we have the leadership and advice that we need to do our work. And so it's a busy day. It has a lot of responsibility attached to it, but thankfully, I am no stranger to responsibility, having been a state health director, having been a physician, responsible for uh, decisions that impact people's actual, lives. I'm no stranger to heavy responsibility, and I will leave easy problem solving to others. That has not been my career choice, and so I happily take on this role and accountability without hesitation.
Okay, great. And what advice would you give to me or other persons starting their careers in philanthropy?
Uh, uh, One, I dare you to leave philanthropy once you enter it. It is a wonderful field of, again, potential purity of purpose in philanthropy is unparalleled. But I would advise you, as I was advised, which is again, dig deep and think about what you're about. And if you focus on that, then I think the opportunities will come to you, and you'd be so lucky to have an opportunity in philanthropy. It really is a great field.
Okay, thank you. So this is the Furious Five, the last section of the show, the 5 questions I ask all guests. So number one, what advice would you give to a student trying to pursue a career in public health?
Um, well, I guess I would assume that they were getting some training in public health. I think that that's really one of the major decisions is deciding to actually pursue that degree. I don't know many ways around, getting an MPH to work in public health. I think you'd be well served to do that. And then beyond that, again, I go back to the advice that I had, really try to focus on what it is that you want to accomplish with this degree, because it is a very broad field. And then, if you focus on that, then that might help to lead you to the specific, concentration that would work for you, and onto the specific career.
Okay. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
I didn't write this script, and so I couldn't reproduce it if I tried. But I would say again, pursue your interest to their highest degree. I mean, I've really pushed myself at every step along the way, and take advantage of opportunities that come to you. That has been the real lesson from my life. Laura from Lumberton, there are a lot of things you can do if you just want to help people. And so, if I hadn't said yes to the opportunities that presented themselves, even when they seemed like a stretch to me, I wouldn't be here today. And so that has served me well, saying yes. I'll do it.
Okay. Number three, what's something you are working on improving in your life right now?
Um, well, again, I hopefully Omar and I make this sound easy, but the truth is, these are these are big positions. There's stress is real. There's a lot of stress involved, and so like everyone else, I'm working on not balance but integration. How do I integrate my work and family life, and how do I integrate self care into this work? Because I would say there is a cost, there is a high cost for many of us to pursue these, high responsibility, high accountability, high stress kind of positions. So I would encourage folks to be cognizant of what it takes to take care of yourself and provide the kind of support that you need to get through these, not just to be in these positions, but to thrive and to be happy.
I like that. Number four, professionally, do you recommend anything?
Well, one of the things about philanthropy that's wonderful is that we get to be lifelong learners. Yeah. And that is great with me because I pursue learning like some people pursue chicken and collard greens. I mean, I love conferences and listening to things, and reading is a huge um, constant in my life. But again, take advantage of opportunities to learn from others. I've had a lot of lived experience. That's hugely important, that everyone will have, but it's also helpful to get perspective from other people or other people's experiences. And so, tell you a quick kind of story. I think as part of one of my boards that I was on, we did an actual tour through the South. And so I got to go to the Legacy Museum and the National Memorial for Peace and Justice in Alabama. And, I hadn't pursued a career in criminal justice, or, I didn't know much about our history as it related to some of the, mass incarceration and lynching, but was really able to get an interesting perspective by going there and learning about historical issues that I was not familiar with. And then I've also gotten to hear Brian Stevenson, and in doing that, that took me to the book The Sun Does Shine, Anthony Ray Hinton, who is one of the folks that Brian Stevenson worked with on death row. And again, I've read a lot of books. A lot of them had impact on me, but reading that and seeing the perspective of this person who was on death row, and what it, how he handled that, was just, again, it allowed me to learn from a perspective that is really just so different from mine. And so I would encourage folks to take advantage of opportunities that you have to walk a minute in other people's shoes and learn from that.
Yeah, thank you. It's very insightful. And last but not least, where can people connect with you or reach out to you if possible?
Awesome. Well, again, we revamped our website recently, and so I know this may date me as whatever, but go to the website www.kbr.org, and if you guys don't know where that is, I guess we're on Facebook or Twitter, and I guess now I'm on podcast somewhere out there. I'll find it, or show me where it is before long, but you can reach me and follow me, I'm sure, on those platforms.
Okay.
Amari, I have no idea. Is that true?
Yes, that is true. You can find her in all those places. That is perfectly true. Well, I appreciate you taking your time to be on the podcast and share your story. I think it's such a fascinating one, and I look forward to working with you and learning from you, because I feel like you have so many insights and so many great perspectives. And I'm just really excited to be here as part of the team for the trust and just continue to push this work forward. So thank you for giving me this opportunity and for allowing me to interview you.
Thank you for having me. It's been a joy.
Great. Well, I'm glad that you all tuned in today, and I hope that this episode with Dr. Laura Gerald was very informative and it helped you all understand more about the KP Reynolds Charitable Trust and the work we do. And I'm just very thankful, very grateful, and happy to be in this role and in this organization with this amazing team. And I just look forward to just continually learning and working to improve the health and well-being of our people in North Carolina. So if you have not as yet, definitely subscribe to this podcast, leave a review, follow me on Instagram if you haven't as yet. That's at the PH Millennial. But I appreciate you all logging in today, and I will see you all next week with some more great content. Public Health Millennial out.